Hey guys, I'm here with Dr. Michael McCracken at McCracken Eye and Face Institute. You can find them at their website there. We're here to talk about cosmetic surgery and some of the exciting procedures and treatments available today. So, Dr. McCracken, thank you very much for joining us today. I appreciate it.
Thanks so much for having me, Caleb.
Yeah, absolutely. And I wanted to start off just by asking how long you've been working as a plastic surgeon.
So I'm trained as an oculoplastic surgeon. I specialize in the eyes and face, and I've been out of training here in the Denver area since 2003, so 19 years at the moment.
Okay, awesome. Yeah, that's great to hear. Was there anything in particular that drew you towards that and made you want to, be able to get started in that?
Yeah, I was exposed to plastic surgery during my residency training, which made me decide to pursue fellowship training. And I just really enjoyed being able to make people feel better about themselves and show them pictures from before and after and what a great change they've had. And I find that patients tend to be very happy when you're able to give them a little more self-confidence.
Absolutely. Yeah, I could see that. I could see that being very fulfilling too. And then since the pandemic has come to a close here, have you guys realized an increase in patients coming in for procedures?
We surprisingly saw a huge uptick in procedures when the pandemic hit. So as soon as we were able to come back to the office after about 6 weeks, there was an enormous demand. I think people were seeing themselves more on Zoom and stuff like that. And
Yeah.
there was just a huge demand for cosmetic surgery, and that's continued ever since.
Yeah, absolutely. I could see that. What are some of the main procedures and treatments that you provide there at your office?
hmm We do a lot of blepharoplasty, so eyelid surgery, either for heavy upper eyelids or baggy lower eyelids. Sometimes we need to treat some swelling in the cheeks, which is festoons. We have some treatments for facial laxity. We do eyebrow lifts. And we've also, for the last 5 years, taken a real interest in hair restoration.
Okay, awesome. Yeah, that's good to hear. And what are some of the kind of main benefits of doing those procedures? Is it just achieving a little bit more youthful appearance?
Yeah, I think a lot of times patients look at themselves and just feel like they look like their mom or their dad and just don't feel like they look like they used to look. And so, I tell patients we don't want to turn you into your favorite movie star. What we want to do is make you feel like a younger and better rested version of yourself.
Yeah, yeah, absolutely. I think that's great. What are is there a couple specific procedures that you would really like to kind of inform the viewers about?
Yeah, we do a lot of blepharoplasties here, upper lids, lower eyelids. I usually use a laser to do the incisions, which is really neat. We don't need to use a scalpel to do the cutting,
Right.
and it's causes a lot less bleeding. It's a lot drier of a surgery and less bruising afterwards. We do a lot of laser resurfacing in the lower eyelids, and that allows us oftentimes to avoid having to make an incision in the skin. And most of my patients really like the idea of not having to have any kind of incision or stitches in their lower eyelids.
Hmm.
Um, Festoons sometimes go along with lower eyelid issues, and that's that swelling kind of down here on the cheeks.
Mhm.
And oftentimes we'll treat that with laser, and oftentimes also with radio frequency treatments. We have Accutite and Morpheus 8, which are pretty non-invasive
Mhm.
radio frequency tightening devices that can help tighten that area and get rid of that swelling.
Okay, definitely. So it sounds like it's more of a complete approach to their goals and not just specific procedures at a time.
A lot of times patients will come in and their neighbor or their parent had, a certain procedure. Most commonly, they had a blepharoplasty in their upper eyelids.
Mhm.
And, I went through this with 2 or 3 patients just today, where just because someone had procedure X
Mhm.
doesn't mean that that's the best procedure for you. So I like to really do a thorough examination, talk with the patient about their goals, and pick the right tool out of the toolbox to fix the problem at hand.
Absolutely. Yeah, I think that's really important. And so how long do the results typically last with the patients that choose to get the blepharoplasties?
Yeah, I try to be conservative, so I'll tell patients 5 to 10 years, but usually we find that the results last about 10 years.
Mhm.
We're able to set the clock back on aging,
Sure.
but we aren't able to stop the clock entirely. And so patients will continue to age. Patients that come in and say, I'm 40 years old, I want to do this right now and never worry about it the rest of my life. We need to have a real talk about expectations in that case.
Yeah, absolutely. What are some of the follow-up, treatments and procedures they can do to kind of keep that going and keep the results longer?
Great question. So a lot of times we're able to extend the results with doing some additional laser, maybe doing some radio frequency treatments to the eyelids. Sometimes patients will need to do a little bit of a brow lift if their brow starts to sag over time. So it's not always about taking out upper eyelid skin or lower eyelid skin for that matter.
Okay, yeah, definitely. And is there any particular, follow-up treatments they need to specifically do themselves to help maintain that as far as, just taking care of that skin?
I like to keep things pretty basic. I don't have patients use silly things like hyperbaric oxygen and all kinds of expensive things and lymphatic massage. But for me, I think that using ice, which is pretty readily accessible at home,
Sure.
for the first few days, keeping any incisions or lasered areas moist with ointment a couple of times a day. And then we do have some cream that we often use to help. It's an anti-aging cream, but it accelerates the healing process. And a lot of times we recommend that, and that speeds up the healing process.
Okay. What's the average, surgical time and recovery time for patients doing those blepharoplasties?
Mm-hmm. So for the upper eyelids, the actual procedure takes maybe about 15 minutes.
Okay.
And the lower eyelid, it kind of depends on what approach is necessary, but oftentimes we're able to complete that procedure in about half an hour or so. And as far as recovery, I tell patients that usually it's about a week of bruising and swelling and probably not wanting to work much because your vision gets a little blurry from some of the swelling in the ointment. And I tell patients don't have a big family event like a wedding or something like that for a couple of weeks, just to be on the safe side.
Yeah, definitely. Okay. And then, I know surgical cosmetic procedures have come a long way over the years. And you mentioned that you guys use the lasers as part of those blepharoplasties. Can you elaborate more on, kind of how that's come into the practice?
Uh-huh. So I've been using laser for quite some time. Not all surgeons use it, but I've probably been using laser since my training ended back in 2003. And, it's an added expense to be able to provide that laser device. But again, I think that it really has advantages as far as causing less bruising intraoperatively, or less bleeding intraoperatively, I should say, and less bruising as the patient is healing. The laser also allows us to do non-incisional tightening of the skin to help with wrinkles, and it also thickens the skin. So a lot of times patients will have some discoloration, those purplish or bluish circles under the eyes, and the laser can thicken the skin to hide those changes below the skin and that coloration.
Okay. Yeah, that's awesome. And who would you say is, really the ideal candidate for blepharoplasty?
That's a great question, and it's not necessarily age specific. We really look at the anatomy and what kind of anatomic changes are going on. So I try not to have an age cutoff as far as too old or too young. I would say on the younger side, there are some people who will come in for some congenital things, maybe around 20 or so. And on the upper end, I've operated on, patients in their 80s, maybe even 90s.
Wow.
More important than the actual age is the anatomic changes that we see. And of course, the patient's overall health. If they're, on life support, it probably isn't a good idea to do surgery. But as long as patients are reasonably healthy, I don't think that age needs to be a restricting factor.
Yeah, absolutely. And I think that goes back to what you said about really making sure that it's specifically for that patient. It's not just, you're doing this and trying to get the exact same results for every single person.
Yeah.
Absolutely. Okay, awesome. And then lastly, is there, any advice you had for patients that are, maybe thinking that they might be a good fit for it and are thinking about coming in to see you guys for a consultation?
Yeah. There are a lot of people who want to do cosmetic surgery. And I would advise reading up carefully on the surgeon that you're considering.
Sure.
Go to their website, see what their credentials are. I, for example, did a fellowship with the American Society of Ophthalmic Plastic and Reconstructive Surgery. I'm a member of that society, and I think that that's kind of a bar for excellence in eyelid surgery. I think it's also important to look through the surgeon's before and after photos.
Definitely.
Sometimes I tend to be very conservative. I figure that we can always do a little more if necessary, but it's very difficult to take out a bunch of skin and have to try and put it back in again.
Right.
So I think it's important to look at before and after photos and make sure that the surgeon is giving patients the kind of a look that you're interested in.
Yeah, absolutely. Okay. And then for patients that want to reach out and get in contact with you guys, what's the best way to reach you?
Well, there's a contact section in our website, which is mccrackenmd.com, mccrackenmd.com. And we obviously take phone calls as well at 720-851-6600.
Okay, perfect. Well, thank you very much for taking the time to talk today and give us some good education on that. I appreciate it.
Well, thanks so much for having me. It's been a pleasure.
All right, awesome. Well, have a good rest of your day, Dr. McCracken. Thank you.
You too, Caleb. Thanks.